Hi, my name is Christy Carlson. I'm a family-based therapist at Wesley Family Services. I have an employment-based practicum, so I actually started working here and then decided to go back to school to get my master's in social work. Before that, I was a school counselor and I really liked it, so I decided to go back and do social work. The mission of Wesley Family Services is to empower children, adults, and families by providing transformational care. The vision is to do more for more children, families, and adults, to be more effective, efficient, and sustainable, and continue to innovate in what we do and how we do it. Wesley Family Services is a nonprofit organization that serves more than 20,000 individuals annually throughout southwestern Pennsylvania. Our more than 900 caring staff members and highly trained and licensed clinicians are committed to providing high quality behavioral health care services and support programs to children, adults, and families over the course of their lifespan so that they are empowered to reach their full potential. Two of my own children went here for services, so when I was looking for a job, I was already familiar with this organization. It's a big organization. It has many locations and many programs. I work as a family-based therapist. It's had many different names over the years, and it used to be mainly for autism. So there's a lot of autism support. It has adult behavior support services, Autism Center for Growth, autism outpatient services, creative arts program, healthy relationships, outpatient groups, intensive behavioral health services, IBHS, parent-child interaction therapy, psychological services, school-based partial hospital services, and Wonder Kids. Aging services foster a grandparent program and service of seniors and open your heart to a senior. Options care management, PA, MEDI, and a senior day program. Behavioral health, acute partial hospitalization, administrative service coordination for children and adults, adult diversion and stabilization, adult drop-in centers, assertive community treatment, blended service coordination for children and adults, creative arts programs, engage, enhanced targeted case management, family-based mental health services, and functional family therapy. Some more of the behavioral health, mental health outpatient and intensive outpatient program, mobile medication team, mobile psychiatric rehabilitation, parent-child interaction therapy, psychological services, school-based behavioral health services, school-based partial hospitalization services, and site-based psychiatric rehabilitation, and more. There's also justice and child welfare, aggression replacement training, family-based mental health services, foster care adoption and post-permanency services, functional family therapy for child welfare, in-home services, and parent-wise education classes. Community empowerment, battering intervention program, child court-ordered parenting classes, foster grandparent program, in service of seniors and open your heart to a senior, New Kensington Downtown Partnership, fresh food shuttle, options care management, PA, MEDI, parent-wise education classes, representative payee program, St. Margaret Foundation, free medical shuttle, Veterans Helping Hand Fund, Wellness Center, and Westmoreland County free medical shuttle. Education. acute partial hospitalization, kindergarten and school readiness program, psychological services, school-based behavioral health services, school-based partial hospitalization services, the Bridge program, and Wesley has two schools, a K through 8 school and a high school. There's also foster care, adoption, and post-permanency services. And then for developmental and disabilities, adult behavior support services, adult developmental training center, community employment integration program, creative arts program, facility-based vocational rehabilitation, IDD residential program, life sharing program, and a senior day program. So you can see there are many services and programs and even different locations and different types, whether that's going into the schools, whether that's going into homes or people coming to an actual facility. There's a lot of different services. So I thought I would focus a little bit on what I do as a family-based therapist. Not everybody who is a family-based therapist has an actual license. They are in groups of two, so everybody has a partner, and they have one master's level and one bachelor's level within the team. Family-based is a service that provides families with crisis intervention, prevention services, service coordination, and it's for families with at least one child who's at risk for higher level of care in the home, which means like they might be at risk for hospitalization or a residential treatment facility. A referral is required for enrollment. So how family-based got started is they noticed that kids who went to a residential treatment facility would go back home, and then they noticed that when they were back in the same environment, nothing had changed, and they went back to, the way they were before. And so they thought what would be better is if people came into the home and helped the children with their environment. So we do a lot with parents and the rest of the family with a systemic model, helping even like sibling relationships. We help with the school, any other providers. We'll collaborate with other providers and just do anything we can to help the child and the family in their own environment. Okay, to be eligible for family-based, the child has to have a current medical or behavioral health diagnosis and is determined to be at risk for a higher level of care, such as inpatient psychiatric care, residential care, or foster care. And I think they might be a little bit lenient on this. I don't think everybody's had a very high risk of out of care placement. So a lot of them, if the families just need help, will come into. A lot of times they have tried lower levels of care and they haven't been effective, such as outpatient services, IBHS, school-based. We are considered a higher level of care because we come in 2 days a week, at least, sometimes more. And we come for at least an hour each time, sometimes more. So it's considered an intensive service. The child is under the age of 21. The youngest child that I've seen personally is 5 years old, up to, I haven't seen anybody past 18, but it could be. A recommendation for family-based mental health service treatment is made by a licensed physician or a licensed psychologist. So sometimes what happens is, let's say there's a service coordinator who wants to refer someone to family-based. They will talk with maybe the child's psychiatrist so that they'll get a written prescription for family-based. But the referring person is a service coordinator or something like that, or maybe their outpatient mental health therapist at the time. And the child and family must be available for at least 2 to 3 sessions a week, and it's in the home, so we go to the family's home. So, if you're interested in any services at Wesley Family Services, there is a main number, and here's the number. You would call that main number and tell them the things that you're interested in, or you can tell them, I have this situation. What services do you think would be best? And that's all I have for Wesley Family Services.